diagnosed. I used to be very thin talaga. Thin, with regular menstruation.
Okay.
But late 2015, sometime around December or November, I was diagnosed with PCOS. That time ang PCOS, hindi pa siya basically well explained. Dito na si PCOS nag-strike sa health ko. Nung nag-start akong mag-breastfeed, tapos in-stop ko na lahat. As in, kasi syempre, when you're breastfeeding, hindi ka pwedeng mag-diet. Kaya din siguro, I started having hypoglyce, especially ng afternoon. Tapos, yung weight ko, as in, ang laki ko, I started gaining weight. Super drastic yung pag-change ng weight ko from size 2 to size 8. As in, ang laki. Tapos, ang baba na ng confidence ko. Sabi na ng mga brother ko, mukha na daw kung aparador, mukha na daw kung aside from the hypoglyco, drastic weight gain, meron pa akong migraine, chronic migraine. Mainit, malamig, whenever I'm stressed, ang sakit. So talaga siya. Nahihilo na ako talaga, nagsushoot up yung blood pressure ko. Kahit walang trigger.
How did you come across Simply Nature PPARs?
Nalaman ko siya through Ma'am Jansen and Mr. Shyan. So, they introduced PPAR to me kasi one time we were having lunch. So, very ko, akong mom always tired meal. Ako, he looks 30s, 20-something, mga ganon. So, sabi ko, gusto ko ako din. Kailangan, paglaki ng anak ko, mukha lang kaming friends. When I started using PPARs, first month pa lang. Actually, first week pa lang, started texting them na, Ma'am Jocelyn, I don't have episodes of migraine at all. Kasi yun talagang kita ko. Kasi everyday nafe-feel mo eh. Wala, even if it's cold, it's hot. Yes, kasi sabi nila, ang hirap daw, sabi ng doctors, once you got diagnosed with DM2 or diabetes, it's really hard na i-reverse.
Exactly. How did your doctors react?
They were amazed yung OB ko. First time, kasi OB ko na sila before pa eh. So, first time, since 2015, kahit ako, first time naming makakita ng clear, normal.
Guys, just to let you know, as you can see on your screen, the result actually says ovarian is bilateral. So, both sides.
Yes, bilateral. More than 20. Tapos may specific size pa siya. I can share naman yung lab result. Tapos ngayon, left is already clear and normal. Tapos yung right ko, reduce na yung base. So, working on it para ma-clear na siya. So, first of all, I wanna thank Sir Shyan and Ma'am Jocelyn. Really, as in, sobrang thankful ako sa kanila. I thank God for their lives. I have nothing but gratitude for them. Having this product improve my way of life talaga, as in. Tapos more pa para yung ibang friends ko, actually nakikita na rin nila eh. Encourage ko na rin sila, medyo nire-review sila. Tapos kaya mo rin to.
Exactly. And just like how Sir Shyan and Ma'am Jocelyn did it to you, it wouldn't be hard anymore because they see the improvement, they see the result on you as well.
Living witness na sila eh kung ano yung nangyaring changes. Good morning, I am Monique B. Marzan, 31 years old. I'm currently working as a property manager here in BGC. I was diagnosed 2015 with PCOS and I started gaining weight, having high blood sugar and then high cholesterol after I gave birth. When I started using PPAR, the migraine episodes, hypoglycemia, and my drastic of weight stopped. As mentioned, I started to lose weight and look more vibrant. So I tried
Actually, even before pregnancy, I'm already taking PPARs. My husband and I, we were really taking, I think during the time, we've been taking it consistently for 5 to 6 months already. PPARs tablets. So, I even think that helped us during the this pregnancy because based on our experience, we had 2 miscarriages before my 3rd pregnancy and my successful pregnancy. And that time, we've been told that, oh, it's not healthy, that's why you're losing the baby. And then we're on the Lord is timing. And during that, actually with this. So, read and heard cell repairs, body accidents, and I really contributed for us to have a healthy. And what I also that time I have really had difficulty with urgency CF. But after on the 3rd day, I was actually feeling giving birth. We're giving bars, so praise helped me a lot. They said that do not just having pregnancy after pregnancy. So bars also, I know when birth can relate to this experience constant when it becomes like it gets to the next level. So I'm glad that introduced to clean nature. Even so, when it's all this, when I plus it has helped me with my regular bowel to be able to release easier and faster. When I felt, because it's after you have given birth, if you're already constipated, it's go to the next level happen. But when it's all because of changes that happen in our body, healing, so a lot helped me because especially birth, it's normal, you had cesarean, you to put pressure, you're about to go, allowed to push. The cleansing plus really you to be able to release better, easier. Helped me in this journey. And even after I was taking PPARs, that I were taking tablets. So of the imbalance has helped us to regulate, and it has given us more energy and have healthier bodies. So it has no, and so that could you. So you own and test. I'm Nesta, visit my son. So I think pregnancy free with the nature PPAR. Thank you, Simply. I love you.
Morning, I'm Missy Hispan. Po ay B breast and lupa si public school teacher. Nung nalaman ko po na na-diagnose ako ng breast cancer, syempre may devastated po. And of course, the whole family, parang our world, no, falls apart, no, sobrang down. There is no symptoms eh. I just felt the lump. Dalawang lump siya sa right breast. And I was not really going for a check-up sa lumps. I was, magpapa-check up ako sa OB-GYN ko. And I was advised to go to the surgeon kaagad. So, after po ng operation, I was asked to go to oncologist. The protocol is to have 8 cycles of chemo and 33 radiation. When I was in the hospital, sa aking bed, seeing through the Facebook, I saw the face of Dr. Jansen. Sabi niya, makakatulong po sa mga chemo patient, yung simply nature PPAR. So if you will just try, malaking benefit po sa katulad naming mga cancer patient. I was advised to supplement chemo with PPAR powder, saka tablet. So at first I was hesitant kasi very mahal po siya. Pero first chemo ko, taking PPARs, hindi po ako nahirapan. So I was expecting na yung mga nababasa ko, napapanood ko ng mga side effect of chemo. Hindi ko po siya naramdaman. So I was telling my family na parang maganda po yung PPAR sa akin. I finished the whole 8 cycles without any problem. Thanks to my doctor and the Simply PPAR. Po, even my co-teachers, even my family, ang sabi po sa akin, hindi ka mukhang may sakit. So that must be a blessing from up high there, no? That I was able to meet Dr. Jansen and I was able to take Simply Nature PPAR. Latest result of my laboratory, all are normal. Yes, thank you, Lord. Continuous pa rin po yung tablet. So I just ordered 6. 6 ngayong May. So that would last for ilang months. My latest ultrasound, fixed pa din po siya. No calcification or anything. So I thank God for that. Ang papayo ko po sa mga pasyente po na katulad ko, go to the right doctor. No? You pray for the right doctor. Kasi ako pinray ko lang para bigyan kayo ng the right supplements. And para yung journey nyo, yung cancer journey nyo, will be very successful. Kaya nga sabi ko, during my PPAR journey, sabi ko sa sarili ko na I will be the most in the whole wide world. Thanks, PPAR. I will highly recommend po Simply Nature PPAR kasi based on my own experience, it helps me a lot talaga. And it's a blessing to me na take ko yung PPARs. Kaya nga ang sabi ko, I will be the most successful chemo patient kasi may supplement ako galing sa Simply Nature, which is PPAR powder and PPAR tablet. So, blend together, it helps me a lot. And I'd like to thank my daughter, si Cadiz, and also my husband for taking care of me. Hindi siya nagsisisi on that part. Thankful po siya. Kaya nga, nung sabi ko, a-attend kami, and he was very supportive. Binatid niya ako dito. I am Melinda C. Spano. I'm a public school teacher. I was diagnosed with stage 2B breast cancer. Upon knowing my situation, it was really a very devastating event. I was advised to do 8 cycles of chemotherapy and natatakot ako dun sa chemotherapy. But with the help of Simply Nature, na-surpass ko, nakatulong po sa akin. And it's a big help. Lahat po ng side effects ng chemo, hindi ko po naramdaman. So, very thankful to Simply Nature because it really helps me a lot and feeling ko I'm a very patient because of Simply Nature. I trust Simply Nature.
And we are live! Health Today, everyone. My name is Jenny Macanjol. Episode of Simply Health weekly webinar series for 2026. to help patients and families understand their health better, feel supported during treatment, and make informed, confident decisions on their healing journey. We would like to extend a heartfelt thank you to everyone who joined us yesterday for our previous talk entitled From Genetics to Epigenetics and how PPARs help you rewrite your health story. Yesterday's discussion reminded us of something very important, that while we are born with our genes, we are not powerless against them. We learned that genetics, yes, may set the foundation, but epigenetics responds to how we choose to live in a day-to-day basis. Our nutrition, inflammation levels, stress, sleep, and immune balance all send signals to our cells. Signals that can either support healing or add strain. Now, a very natural question follows from yesterday's topic. If epigenetics responds to signals, then what kind of internal environment are we sending those signals from? And that leads us directly into tonight's focus. Tonight's session is entitled Starting the Year Grounded on Basics, Strengthening Immunity to Better Manage Treatments. Now, when someone is undergoing treatment, whether chemotherapy, radiation, targeted therapy, or long-term medications, the body is under constant demand. How well your immune system is supported can influence how you tolerate treatment, how well you recover between cycles, and how stable your body feels overall. Now, when the immune system is overwhelmed, the body stays in survival mode, and in survival mode, healing signals are harder to activate. But PPAR pathways introduced yesterday help support the body by calming excessive inflammation, improving how cells manage energy, and supporting immune regulation rather than immune overreaction. Now, to guide us through this discussion, we are honored to be joined by two individuals who combine science, experience, and compassion in patient care. First, we have a seasoned international speaker on a wide range of topics, from personal success to healthcare, who is also the founding director of Simply Nature International, our papers expert fresh from Singapore, Mr. Shyan Lim. And joining him is Dr. Jansen Kalalat, a graduate of St. Luke's College of Medicine, a diplomate of the International Board of Lifestyle Medicine and the Philippine College of Lifestyle Medicine, currently serving as a consultant at renowned institutions including Alta Integrative Medicine and Wellness Complex of Perpetual Health Medical Center Las Piñas, Tree of Life Wellness Center, Centro Holístico, and Simply Healed Medical Group, where he practices integrative oncology. Together, they will help us understand how strengthening immunity step by step can make treatments more manageable and recovery more sustainable. Good evening po.
Hello, good evening. Good evening, Jen.
Good evening. Good evening.
Well, what are we waiting for? Let's start the AMA. We have a question from yesterday, actually, from YouTube. Miss Christine Lois Lim. Is there any natural way that helps detox blood and liver, aside from beetroot, celery, and others? And how do you lower alkaline phosphatase if it's elevated like 152.82, while SGOT and SGPT is normal?
Yeah, so
This is
for
a question for Dr.
yeah,
Johnson.
yeah, for detoxing, there's a lot of ways to do detoxing, but the primary way how the body detoxes is by the elimination processes of the body. So there are a lot, no? So your liver detoxes your blood. So once the liver detoxes your blood, the waste products go by way of bile. So bile now is being eliminated through your feces, through your stool. So that's one. Number two is through urination. So that would be through your kidneys. Another one would be through sweating, and many other ways. Okay, but these are the primary modes of elimination. So these are how our body detoxes our body. Now, the detoxing procedure, especially for the liver, it utilizes vitamins, minerals, different combination of these, no? So by making sure that you have adequate amounts of these vitamins and minerals, then you would ensure that the liver's raw ingredients on processing the blood and detoxing it would be there. Okay, so it's like assuring the function. Can you hasten the detoxing capacity of the liver? Yes, by ways of so there are a lot. There are a lot, no. So you just need to, you know, get certain or take in certain herbs. Then it would hasten the detoxing process of the liver. So this is actually within the realm, very much within the realm of TCM. So TCM is a field where it utilizes a lot of the liver's functions, influencing different substances. So in on how our body reacts to these different substances. Okay. One such example would be Saint John's wort. So Saint John's wort is an herb that can influence the how fast our body processes certain substances. Okay. So now for this matter, I'm not suggesting you take St. John's wort, okay, for detoxing primarily because these ingredients has to be used like medication. Okay, because if you take something that hastens the metabolism of something, that would essentially that substance would essentially be processed very fast by the body, and that can influence a lot of biological processes both positively and negatively. All right. So that's why. So you have to be careful and make sure you consult a doctor who's very well versed in this regard. Number two, there are certain procedures that we can do to assist elimination. So that's by way of one, sweating. So you can go for saunas to encourage sweating. Number two, you can go for enemas to encourage elimination through your stool. No, you can take in diuretics like certain teas, coffee, to help you urinate. Okay, so that's those are some procedures that you can do. Now, to answer the specific laboratories to how to lower them, there's no one specific solution to that because you have to find out first why it was elevated in the first place. Having elevated ALP does not mean that you are sick. Okay? Or there's a medication to lower that ALP. There's none. You have to understand why it is elevated in the first place. Sometimes it is elevated without reason. Okay? Sometimes it's just a laboratory measurement that comes out with certain errors, or not really errors sometimes, but it just so happened that it was elevated. So it has to be repeated again. Okay? So these labs has to be understood in the context of the patient's history and condition before we give certain solutions on what to address and to reverse the or try to improve the metrics if at all it is possible. Yeah. Okay.
Okay.
Wow.
Moving on.
Interesting. Especially the part on enema. So, Doc, can you elaborate a little bit? How useful is enema? Should healthy people even consider doing enema?
Yeah.
And where's the best place to go and do enema? I know there are coffee kits that you can buy, and it must be organic coffee, and then you can do it at home. Or is it better to go to a center that does enema?
Yeah, so for enemas, we use them primarily for constipation, especially for functional constipation. But aside from that condition, we can also use them just to basically have a reset of your gut. Try to eliminate certain toxins that's sitting inside your gut that is being that's that's being difficult to be eliminated through the gut. So one such example would be biofilms. So biofilms are films that are quite sticky and they harbor harmful bacteria. So um, there are certain situations wherein gut dysbiosis symptoms are present, persistent, and it's because of this. No, so you have to get an eradicator of biofilm, which is serapeptase. Then once you are already on serapeptase for certain periods of time, like let's say a month, then you go for enemas to help to assist the body to remove the bad bacteria that is being grown inside those biofilms. So then afterwards, you take in probiotics to help replenish or change the composition of your gut microbiota. So that's another purpose of enemas. Now, there are different kinds of enemas. No? There are hydrocolonics, which is basically pumping water. There is also coffee enema. So for coffee enema, another benefit is coffee enema can stimulate the liver's capacity to produce more glutathione. So it's also being done if you are a patient that has a lot of inflammation. So I also have them undergo coffee enemas to help clean their gut and get a reset
So
of their gut.
they do it by themselves at home, is it? Or
They can, but they have to be taught first. They have to undergo an orientation first because you have to get the right coffee bean. You
Yes.
have to prepare it correctly,
Yes.
and you have to be able to do the whole procedure by your own independently. So it can be safely done as long as the patient was taught properly on how to do it correctly. So for those of you, yeah.
So a question. So for a normal healthy person like yourself and myself, would we even consider enema as something we want to even try? Is it something worth doing regularly, like once a year? What are the benefits for a person who's not sick, not suffering from constipation? Is there even a reason to do it? Because I hear that when you do coffee enema, while your skin smooths out, you look radiant, you are like you clear years of toxins from yourself.
Yeah.
Is it
Well,
harmful for your microbiome in your gut as well?
Yeah, so the primary reason for a healthy person to do it is just to eliminate toxin.
Okay.
So it's prevention,
So it's worth
basically.
doing. Is it worth doing?
Yeah,
I mean,
it is.
someone
It
like
is.
you
It
who's
is.
51 who has to go for prostate exam.
Yeah. It's
also something
okay.
worth doing. You live 50 years, enough trash has built up in your
Yes.
cell. Oh,
Yes.
okay. I will really consider
Yeah, it is. It is. Yeah. The patient feedback is that after doing the enema, they feel really very light.
Okay.
Yeah, so it's really worth doing. It's really worth doing. It's just that you cannot do it too frequently.
Okay.
So what we advise is during the first month, no, you can do it once a week. That's the closest.
Okay.
But after doing the 4 sessions, you can do it once every 2 weeks or once every month. So that's like maintenance.
Wow, that's way more often than I thought. I thought do once a year. So, question: if you do it like once a quarter, is that going to have any impact on your health? Do you really need to do it so often? Sorry today, I know we usually talk about cancer, but this is a rare thing that we suddenly talk about enema, and it's something that I guess at my age, at 52 this year, yeah, suddenly we're thinking about detoxing. Yeah.
Yeah, and
Yeah,
pasasabi to all our audience who are eating while watching our webinar.
Well, okay. So going back to the frequency, there's no study or clinical study
Okay.
that shows us if getting it quarterly, once a month, every week, once a year, have any differences in benefit. Ultimately, the frequency has to be tailored to the patient's need. So the decision whether to get it quarterly or once a week, would entirely be dependent on what the patient needs and the lifestyle of the patient. In terms of benefit, there's not much actually. There's not much. As long as you eat right and you clean your gut regularly, then there should be no problem. So remember, enemas is just a procedure to get the stool out earlier. That's it. That's it. So whatever you ate yesterday, 2 days, 3 days ago, you're just assisting your body in eliminating it faster. So yeah, that's the
Okay.
only thing that you're trying to do. Ultimately, what health benefits or the health outcomes that you need to achieve would entirely depend on your lifestyle, still your lifestyle, the foods that you're putting in, and of course the supplements, etc. Yeah, so not really eliminating. No, so in other words, you're just hastening the elimination of the food that you are eating. So you can do it this way as well. So say for example, you went to a buffet the previous night, 2 nights ago, and you feel so bloated. You can go for the coffee enema to hasten the cleansing of your gut. If you really feel that it's the food that you ate is staying staying too long inside your gut, or yeah, right. So yeah, so that's one way to approach things as well. Yeah, this is for a healthy person, no? Mind you.
Okay, very interesting. I will seriously consider experiencing an enema. I'll do some research whether there's a good place in Philippines or Singapore.
Yeah,
Uh,
Centro Holistico,
oh,
at BGC, that's one clinic that really does coffee enema. Really good, nice place as well. So for the other patients of mine, another place is Tree of Life. They also do really good coffee enemas. So those are some of the places.
okay, I
Yeah.
will try. I will give everybody an update after my
Yes.
first enema, what it's
Yes.
like. Doc, have you tried yourself?
See the need. I don't see
Yeah,
the
because you
so
are.
I remember a question from yesterday from a CKD patient undergoing dialysis. And his question was, is it dialysis already a form of detoxification by like artificial filtering? So do I still need cleansing plus for detox?
okay. So now you have to understand first, no, why what you are trying to detoxify. Okay, cleansing plus is a fiber supplement. It's psyllium. It's basically psyllium. It's a binder. So if you are someone who doesn't, who's not that fond of vegetables, and you're eating junk every single day, then cleansing plus is a must. So what it will do is to try to bind all the bad fat, all the toxins. Like say for example, you just microwave your food in a microwavable plastic, and then you ate the food on the microwavable plastic. So there would be microplastics inside the food that you ate.
Wow.
Okay, so for that matter, say for example, let's assume that you don't have any other choice. I mean, there's nothing. Say for example, if you don't eat the food on a microwavable plastic that you microwave, you'll starve to death. Then after eating, you can just or together with the food that you just ate, you can drink fiber supplement to help bind whatever needs to be binding. Yeah, so that's an example. So cleansing plus can also help you eliminate can also help with eliminating stool faster. So that's another form of detoxification. Yeah, so really it depends on what goals you are trying to do, and not a general detoxing recommendation. General detoxing for me, no, there shouldn't be a general detoxing protocol for everybody.
Yeah.
Yeah, because you might miss some things. You might be eliminating or detoxing some areas that does not need detoxing, and the certain procedures that you're doing might miss those which need to be detoxified. So I'll give you another example.
Mm.
sauna, and you're just sweating. So there are
Yeah. It's a
certain
way of detoxing, right?
yes, through sweat they've found that you can actually eliminate heavy metals. You can also eliminate if I'm not wrong, microplastics as well through sweating. So
Oh, you can
now,
sweat out microplastics
yeah, because microplastics apparently
are so small
um,
that they
are
can come
so
out of your
small.
food.
They can come out of your sweat glands. So um,
This is really
if
interesting, Doc. I mean, this is really interesting because,
uh,
I mean, look at this, everyone. I'm drinking from a bottle of,
mhm,
plastic, right? So, that's why it's in Singapore, Doc. It's so popular that everybody has their own thermos.
uh-huh.
But here I didn't have enough water, so yeah. So I'm drinking microplastics. I am quite sure of it. Yeah.
Yeah, for sure, for sure. Um, so if you're trying to eliminate microplastics, there's no way for you to eliminate microplastics through stool.
Oh, why?
Yeah,
Why?
because the microplastics are gonna be absorbed. It's gonna pass through the colonic barrier, go through your blood and through your other organs and tissues. So
Oh.
how then are you gonna eliminate the microplastics inside your stool? I mean, it's not gonna be enough. No matter how much fiber you eat how much enemas you do.
So interesting. No, so interesting. Okay. So sweat, another reason why you should go to the gym and work out until you sweat and not just, enjoy the aircon in the gym. So yeah, thank you, Doc. Yeah, please continue, Doc. Yeah, please continue.
Yeah. So again, there should not be a general detoxing recommendation for everybody because each and every one of us are different. So our needs are different. How toxic we are different as well. So the detoxing recommendation should be tailored to the patient. So that's what I wanna put out. So another example, if for example you're pooping 2-3 times a day, and say for let's assume that the stool is formed. Why the hell would you want another fiber supplement? I mean, it doesn't make sense. Yeah, because you're just gonna be pooping out more, and that's gonna be harmful to your body already, for that matter. So, yeah, so it really depends.
One thing I get out from Doc's very elaborate answer is there are really different types of detox, right? There is basically chemical detox where it's a chemical reaction and detox your body, clean your blood. There is a physical detox from sweating, and then there is a detox through your GI, which is supposed to be done naturally if you eat vegetables. But just look at the diet today. Just look at what you ate today for lunch and dinner. I am quite sure you don't have enough dietary fiber. So I hope that answers our viewers' question on they've done a detox program. Do they still need to take cleanse? And here's the thing. If you did a detox program yesterday, today you add toxins to your body. So detoxing is not a one-time thing. It's something that you have to do continuously, right? So there is not it's not like a oil tune-up for a car. You do that and you can good for next 5,000 miles. It's not like that. No matter how you detox, actually, it's only probably going to be good for a week, 2 weeks at max, and depending on how clean you eat after that, right? So detoxing is a constant process. Yeah.
Okay, moving on to the next question from Mr. Norwin. What would be the best recommendation for an 86-year-old patient with lung mass? It's malignant as per PET scan.
Oh, wow.
Okay, 86-year-old patient. Take note, 86 years old.
86 is
The
a
best recommendation would be what the patient wants.
wow, what a wonderful answer. It's a very insightful
That's
and wise answer.
that's I mean, if you look at the answer in and of itself, no, it might sound in
Like you are
Tagalog
giving up or
pilosopo.
fatalistic. No, but
Or
it's not.
it's not oh, but it may sound pilosopo. But listen, 86 years old. For let's say let's assume that the patient is young, or let's just eliminate the fact of age, no? Let's just look at the lung mass. It's malignant as per the PET scan. what you do for this patient is to biopsy the mass. It's not enough that the PET scan shows a malignancy. It will also show that, hey, it's most likely cancer. That's it. But ultimately, what kind of cancer it is, we have to get a sample of the mass, look at it under the microscope, and identify what kind of cancer. From there, you determine what treatment you give the patient. So for the treatment, so one is doing an invasive procedure, which is a biopsy. Okay. Then after the biopsy, you determine the treatment designed for the result of the biopsy. So the treatment for a lung mass that is malignant, so let's say, for example, let's assume that it is lung cancer. Lung cancer has two subtypes, no? Molecularly, when it comes to treatment, there is an EGFR positive mutation, lung cancer, and an EGFR negative. So if it is positive for EGFR, then the patient would qualify for oral targeted therapy. Then all would be okay if it's oral. I mean, there's no hindrance or difficulty in giving the patient the treatment. Okay? Number two, if the patient is EGFR negative, then the only thing that you're left with would be chemotherapy. This is for the conventional side, okay, of treatment. Now, once you have selected the treatment, okay, before we go to the consequence of the treatment, no, let's first address all the possible treatments that the patient can undergo. So for the conventional side, that would be either a choice of targeted therapy or chemotherapy. Another one would be radiation therapy. That's also a possibility. Another possible procedure that can be utilized would be surgery, especially if the tumor is still within the confinements of a single lobe of the lung. Then you can remove that lobe and remove the cancer totally. Okay? So that's conventional. The non-conventional side would be my part. Okay? So for my part, how would I treat a patient with lung cancer? So I would utilize intravenous high-dose vitamin C. It has to be given twice a week. Okay? At least for 8 weeks. Then rest for 2 weeks. Then repeat the thing again until you see the lung disappearing or until you see complications, okay, from the procedure. So that's one. Aside from intravenous high-dose vitamin C, I use nutraceuticals, some medications that I repurpose. For what goal? This is to stimulate the immune system to starve the cancer metabolically of its fuel. So for cancer, you have glucose, cholesterol, and glutamine as fuel. So you give medication, certain natural extracts to starve the cancer of these three fuel. The third approach would be cytotoxic, or I utilize certain medications or natural extracts to kill the cancer directly and to lessen the resistance of the cancer to the conventional treatments like chemotherapy, for example. So that's my part. Now, for non-conventional, if you combine these two, there would definitely be side effects. Okay, the side effects would now be dependent on what path you go for. Now, my assurance for the procedures that I do or the treatment that I recommend for my patients, what I always tell them is that I cannot totally eliminate the side effects that you get from the conventional side. But one thing that I can promise you is that you would be able to finish all the entire recommended the entire number of cycles. Say for example, if it is chemo, you'll be able to finish whatever the onco will give you. And I can assure you that we won't have any negative interactions with the ones that I'm giving you and the ones that the onco is giving you. Okay, and we can get the best outcome from combining both worlds or both principles. Okay, so now the next question is the side effects. Okay, there would be side effects, of course, because you're either gonna be receiving targeted therapy or chemotherapy from the onco side. And from my side, although what I can also assure you is there would be less side effects from my end. It's not as toxic as what the oncos are giving, but there are side effects. Okay,
That's good.
so Now, the next question would be, is the patient open to everything, to all these things that can happen, and the expenses? So this is another thing that the patient would have to be considered. No, although we have this plan for the patient, but would the patient be open to taking different supplements? I mean, at least 5, at least 10 different pills at a time. So that's the first question. Another one would be financially. Can the family um uh tolerate the financial burden of such a plan, or such a protocol? And number three, would the patient even be amenable to this? No, considering the age. So um that would be the approach, no, that I would be that's the approach that I would be discussing with the patient, not just a lung cancer, but any cancer patient that I encounter. Now, yeah, ultimately, whether or not the patient goes through this would depend on, number one, the patient himself or herself, and number two, his support group. No, but um, we all have to follow what the patient wants. Yeah. So I think that's the best recommendation, because even if we have this beautiful plan, okay, this a very intensive plan that is gonna give us the best outcome, if the patient will not take the medication, if the patient will not be able to do the procedures, then it's useless.
Um, I wanna chime in on where Doc Jansen left off. Those very wise words that he says. The right treatment would be what the patient wants. Because and I would like to speak, I guess, philosophically. um, it's an 89-year-old person. I think we might consider whether our love for this person, how are we going to demonstrate it? Some of us feel that curing our parent, no matter what, is loving them. I read, Doc, my mind changed because I read this article about a doctor writing about do not resuscitate. You can sign a document so that your children don't try and resuscitate you. And the reason why he wrote it is because he knows, as a doctor, for example, your elderly parent is not conscious. That means eyes closed, cannot talk to you, cannot react, and then the heart goes in, the heart stop. So there's the option to do CPR, right? And it's an old, maybe 70-year-old, 75-year-old. So the doctor says what the family will be crying and pleading the doctor to do CPR because they want to save their beloved parent. He said, but what is so difficult for him to explain at that moment, and no point trying because the kids love the parents so much, just want to save the parent. So the doctor has to do CPR, but the doctor knows there is a very high chance, though the parent cannot talk, cannot move to communicate, the parent can feel the pain of their ribs breaking when you do the CPR. And even though it might be the most painful thing they've experienced in a long time, and their last moments in their life is filled with pain. Imagine your ribs being crushed, your bones cracked. They cannot cry out in pain. They just reacting. And the kids at this point may not even realize all this because they are crying and missing their mom or dad. And they think they're doing their very best. They're being a good child, right? Because they are trying to save. Every good child will try and save their parents' life, right? So it seems like they're doing the right thing. But the doctor wrote in the article, what they have actually done, and sometimes I think he also mentioned sometimes it's quite difficult to tell the children. They thought they did a good thing, but in truth, he knew they made their parents' last 5 minutes of their life the most painful, physically painful 5 minutes of their life. So I really want to inject here that I think there's great wisdom in what Dr. Jansen said, right? So that especially for a life that has lived 89 years. And I pray that for your loved one, it was a very good 89 years, right? So, and it's important how to respect what this person, how they want to end the journey. And I will share with you, I'm not just speaking theoretically. This is what I did also. So when my father was 72 years old, he had a cancer scare. He actually beat throat cancer first time round. So this is a recurrence. So he had a nodule and they had to do a biopsy. So he informed us. So I told my dad, I said, Dad, please let me know what you want. If you want to go all out and fight this cancer, please let us know, because as your children, we will need to prepare the war chest. That means we will need to speak to ourselves, among ourselves, and prepare the amount of money. And we will go all out. Your father will go all out, right? But let me know what you want. This is what I just want to let you know, as your children, we are prepared to do everything to give you all the best treatment, so that you have the best chance of beating the cancer if it is malignant. So my dad's answer to me was this. He said, son, just make sure I don't want to be in pain, but don't try hard to save my life, because the best days of my life is in the past. So he honestly said he couldn't see anything better to happen to him. So he would rather, the thing he wants to avoid right now is actually pain. He's not afraid to finish his journey. He's afraid of pain. And I want to let you know, this is also the same answer my mom told me when she saw my dad. She said to my son, if mommy got anything, just if the important thing, he said, I know I'm going to heaven already. So the important thing is make sure that I don't suffer. All right. So just make sure that I don't suffer. So I think this is something, what Dr. Jansen has mentioned is something worth thinking about. All right. If your parent wants to fight, then great. Do everything and have a consult with Dr. Jansen, so that you can explore. Because if you consult with only an oncologist, then your only options are conventional medicine. But if you consult with Dr. Jansen, you will be able to have multiple options. So because you said, what can you do, right? So why not explore everything? But if your parent wants to enjoy life, be happy, and be pain-free, I think number one, you can start with one is always the PPAR extract liquid. Not so that, not because you want to beat cancer, because I can tell you, the minimum effect of Simply Nature PPAR liquid for an 89-year-old with cancer is this: they should feel more energetic. So hopefully it will give your parent the quality of life, whether they want to fight cancer aggressively or they just want to enjoy the last season of their life with you. All right. So you can also explore options with Dr. Jansen about palliative, which means to let them be as comfortable as possible. I have another experience, right? Another experience I just want to share with you guys, so that you know that we're not just talking. We went through personally also. My grandmother also died of cancer. She had bone cancer. So I want to let you know, she waited for me to come back from Philippines to Singapore to at least say goodbye to me. But my auntie told me this. My grandma asked my auntie, it is so painful, even with the morphine drip, right? And my grandma was actually 92, I think. So in Singapore, when you're 92, have cancer, they actually don't allow you to stay in the hospital, because I know it sounds very terrible, but they are literally saying, please give up your bed to someone who has a longer life ahead. Okay, so they actually, no, I mean, Jen is doing this, but it is really the practicality in Singapore. So they will move her to a hospice ward where their main care is to relieve her pain. So she was on morphine drip. But even though she was on morphine drip, it was very, very painful. So my grandma actually said to my aunt, right? My aunt told me this later. She said, your grandma asked me, it is so painful. She asked me, can I jump out of the window? Okay. So my aunt answered her, according to our faith, if you commit suicide, you will go to hell. Then my grandma said, okay, then I will hang on. So this was also her testimony in her eulogy. I said, grandma was very focused on getting to heaven. So because she was so focused, she bore with the pain. I just want to share with you, because sometimes many family members are so focused on treating the cancer, they forgot to have a heart-to-heart conversation with the patient. So I want to encourage you. I think Dr. Jansen has said something so important. You know, at 89 years old, I think his first answer, do what the patient wants, is a very good place to start. And of course, he also listed out a whole list of options to really aggressively fight the cancer. So in our program, we really want to present to you the full picture, and I hope that helps you in choosing what's best for you and your family, and of course, for the patient. Jen.
Okay, before we move on to the next question, let me just greet our avid viewers, Miss Noemi Alana Veres from Bicol, Sorsogon, Miss Jan Q, Mavus Agot, and Ramir Caleja. Happy New Year po to all of you. Okay, next question. From Miss Bell. Is it possible for a biopsy to appear as benign, but CT scan suggests it's malignant?
Yes,
Oh, wow.
it can. So this is an issue of, so there are a lot of possibilities to why this is the case. No? One is the sample really turned out to be benign. Okay. The CT scan just tells you that there are certain characteristics that looks malignant. Okay. So if there is a discrepancy like this, which do we follow? We follow the biopsy report. Okay. So, however, of course, no, if you have such a discrepancy, you have to make sure that the result is repeatable. Okay. So you look for consistency in the outcome or in the result. So if I have such a patient that came to me with a biopsy report that says that it's benign or normal, then you have a CT scan that tells me that, hey, it's malignant, then I would ask for a repeat of the biopsy, a repeat biopsy. Okay, get another sample and let's take a look at it under the microscope again and see if it really is benign. Then if it is really benign, then we follow what the biopsy report says.
Oh,
Yeah,
wow.
because sometimes,
Doc, I just want to point out something, because one of the things that we are afraid of when it comes to doing biopsy that many cancer patients always ask you is, if I do a biopsy, will I risk spreading the cancer? But since the first biopsy says it's benign, that fear is actually not relevant anymore, right? Supposedly it's not cancer. So you're just doing a double check, right? Because before you walk away, you're doing a double check. There's no more risk, because all likelihood that it's benign, but because of the initial malignant and somehow just do another biopsy that you are totally sure. I think, I just want to bring that up. I mean, to me, logically, you don't have anything, you don't have a reason not to do the biopsy anymore, since,
Right. That's correct. That's correct. No. So now for biopsy, for those patients who are afraid, no, my cancer might spread. Okay, you undergoing the biopsy procedure is you have, this assumes that you are ready to undergo whatever treatment the onco is gonna give you. Procedure, and then you're not gonna get the treatment anyhow. So why risk yourself to undergo the treatment in the first place if you're not gonna get treated in the first place? Okay. So if you're someone who doesn't want any medications anymore, or you don't want treatment anymore for whatever needs to be, whatever, for the cancer, then by all means, don't do the biopsy. Yeah.
Jen?
Okay. Well, we're almost at the end of the night session. This will be our last question for the evening.
Okay.
Thrown to us privately. I saw on Facebook about PPARs with Dr. Joy. I was diagnosed with a kidney mass. What would be the best option for me?
Kidney mass. Okay, we have to first find out if the kidney mass is malignant or benign. But if you're asking what PPAR product would be best to go for, it would be the liquid. Always the liquid. Yeah. So would you need the liquid only, or would you need any other things? Yeah, depends on the biopsy.
Yep. And then go for a consult with Dr. Jansen. To
When
find
you
out.
saw Dr. Joy,
Or go
Dr.
back to
Joy might
Dr.
have
Joy,
a different
right?
answer. I mean, yeah, you can
Yeah.
go for a consult
Yeah,
with
go
her as
back
well.
to
I mean,
Dr. Joy. Anyway, Dr. Johnson, Dr. Joy, and myself, we were together at the SMX. So look out for the next SMX, physical SMX in SM Aura. We will probably do it sometime in the early part of this year. So you'll get to see all three of us, and maybe even Doc Jimmy this time round, right? So you get a surgeon, an integrative doctor, integrative MD that specializes in cancer, like Dr. Jansen and myself. So look forward to that. All right. Yeah.
Well, I'm afraid that's all we got time for today. So as we wrap up this evening, we'd love to hear your final thoughts for our viewers.
Final thoughts. So I'll go first. The question with the 86-year-old patient is quite interesting. Quite interesting, no? So my final parting words for all of you guys listening to this. Cancer is such a complex disease that it affects us mentally, emotionally, physically as well. And it doesn't only affect the patient, it also affects the people around the
Yes.
patient. Okay? So everything can get very confusing. So for everybody to be grounded and for everybody to be on the same page, you always have to ask what the patient wants. Because the moment that it becomes not about the patient will suffer.
Wow.
Okay? For the people around the patient, it's always very important that you reflect upon yourself and ask the question, are the things that's being done to the patient, is it benefiting the patient or benefiting you yourself? Okay, because sometimes we don't want to let go of certain things, certain issues in life, and it can be very difficult, no? Acceptance. But the moment that this influences the treatment or what decision has to be made for the patient, it only becomes about you, which is really which shouldn't be, because the patient is the one who has the diagnosis. So for everybody, so just a guiding principle, no? So everybody would be on the same page, and for everybody not to fight and quarrel, okay? You always listen to the patient, okay? No matter how difficult that patient's decision may be, you follow. And as much as you can, deliver. Okay, deliver. So that would be my parting words for everybody. I'll give the floor back to Sir Shan.
Wow.
Good night.
Doc,
Good night,
how
everybody.
do I beat that? In our very first program, you said the wisest thing. And guys, I just want to say, even Doc Jansen is speaking from experience, because I am friends with Doc Jansen. I know what he went through to able to tell you what he just told you today. All right. So even he has gone through loss in his family and difficult decisions, and saw the consequence, the impact of the family's decision on the patient. So me and Dr. Jansen are sharing this with everyone from the bottom of our hearts, from our personal experience, and of course, from the benefit of also seeing many patients go through these very difficult decisions. This is the beginning, first episode of the 2026. I do want to start on a positive note, and I think that heartfelt sharing and from Dr. Jansen and myself about the question from the 86-year-old patient is a good start. We start this year from the heart, and I think we start this year by reminding everybody the focus is on the patient, not what we want to do for the patient. There's a very big difference. And especially for those whose the patient is elderly, I think honoring that their final, what they want to do is like one of the last things we can do as their children or as their junior, as a sign of respect of their life and their life experience, right? Instead of disregarding what they want. I think that would be the worst last thing you ever did for your parent, disregarding what they want. Amen. So I pray that we started this year with a word of wisdom, and we look forward to the many programs that are coming up. For those who are first time in viewing us, I hope that today's conversation reflects or let you understand Dr. Jansen, myself, Jeff, and Sheila, and our whole team, where we come from. And we look forward to sharing with you the next episode, maybe more technical things. And Dr. Johnson went very technical today also, even with this specific question. So we are here to serve you. We look forward to serving you this 2026. So
Each of them next webinar or via direct message. And we hope to see you again next week for another empowering session. Same day, same time, every Thursday night at 7:30 p.m. Promo nationwide for PPAR's liquid vial and powder jar only, exclusive via website orders. That's www.simplynature.asia. Also tonight, we're proud to introduce a new beginning for sensitive skin. We're offering buy two, take one, AD Pro Psoriasis and Eczema Probiotic Serum. It contains no steroids but natural probiotic support designed to help reduce inflammation from the root cause and support healthier skin microbiome. And thank you once again for watching Simply Nature webinar powered by SMG or Simply Healed Medical Group, because your curiosity and victory about your health condition is what fuels our mission. Here in Simply Nature, we're always with you from start to healing.